to talk about a specific effort, and it's a major effort. It's procuring or implementing a new integrated electronic health record. What can you tell us about what's going on in this area? More particularly, what are some of the biggest challenges, and what's your criteria for success?
So, it's interesting when you talk about an electronic health record, and I've been part of this journey. Now I've been up in Washington for almost 4 years now. Even in the last 5 years, so when I go back to when I was a young physician, a medical record was a folder in your hand, a paper, and in it were notes and copies of pharmacy, lab, X-ray, and then your notes, and that's all it was. It was an entity to itself. Now, fast forward, and then we've all many of our medical institutions out there have adopted an electronic health record, and we of course have ours called Alta. And it's no longer just a documentation of the healthcare delivered. Okay, it is also now, because it's now electronic, it collects data. So when you think about it, it's data that you can use, all right, for either for surveillance, or you can use it to it's just as important, more importantly, monitor outcomes, data driven, clinical practice guidelines, and then you get to collect the data, feedback loop, performance improvement. So it's a clinical process now tool, and you've got the whole concept of if you pop in a diagnosis or you have this set of symptoms, we have the ability now for what I call clinical input. So it says, have you thought of this? Did you order that? Or it's even more exciting is what are contraindications? And so you write a script now and you say this, and all of a sudden, because it's electronically stored, it compares databases, and now it says, hey, this person's also on this, it's a cross-reactivity. Or as you can see in the future, as again in the whole genomics field, we're finding that there are certain gene sets that make you more predisposed to reactions to either medications or procedures. So the opportunities are endless. So it's no longer just that. Now, that's just the medical support. Yeah. All right. So what we have come to find out in the last 2 or 3 years, maybe even the last year and a half, is now these are becoming business support tools for a clinical support entity. So when you think about it, you're putting in pharmaceuticals. Every time that you order this particular procedure to be done, then you're going to go through this number of, whether it's a incision and drainage kit, or whether it's another set of IV or medication protocol. It can automatically again feed and trip to look at your supplies. And then you can use it for coding, you can use it for billing, you can use it for a lot of different things. And so this thing that used to be called a medical record, that I remember when I was a young, intern or resident and young physician, now has become not only a clinical support tool, but a business support tool. And so when you think about that, it is getting the communities together. So before, the docs were doing their thing, and the hospital administrators were doing their thing. Well, the hospital administrators and the docs got to be sitting in the same room now. And so you've got to have the clinicians need to drive, because this is a support tool again for the practice of medicine, but they need to do it in concert with what I call the business support folks out there. So that's an interesting merge of two very professional groups out there that are coming together to define the requirements, because it's not just I just need to write down what I gave you and boom, here's this, but it's also, how does that best feed, or how do you, hey doc, hey nurse, hey tech, how do you want this to best support you which then will support us on the business end. So that's pretty exciting times to be on the leading edge of that. And we've been talking to industry leaders again, folks, their experiences that have converted to what I call a next generation healthcare record, whether it's Kaiser or it's Vanderbilt Health, or, Children's Hospital Wisconsin, Intermountain Health, several folks out there, to say, hey, procuring it's not easy, but procuring whatever the electronic health record, that's a decision that has to be made. Okay, the hard part is basically installing it, in that installation process, because you're going to have to run two systems. You're going to have to stand up the new system, of which, of course, you've got to lead turn that by 6 months or more, training, get everybody ready for it. At the same time, you still have to run your current legacy system, and then that transition, and then from a macro perspective, which will be our responsibility, will be then how do you basically unplug, at the right time, the legacy system when the new system is fully mission capable. And as you can imagine, this is going to happen over several years, because we're a global enterprise.
Oh, yeah.
We're a global enterprise. And one of the other things that's different about us than, say, a healthcare network is that we have a requirement to document and collect healthcare data in some pretty austere environments.
Yeah.
And so I use the word, from the foxhole, and then if you're in a facility in a tent on the Afghanistan-Pakistan border, all the way through our medical evacuation system, in our air medical evacuation system, and then back to our military treatment facilities, our polytrauma centers, into the VA, and so we have a wide, and then you've got shipboard, and you've got undersea medicine, and you've got aviation medicine, and so it's a little bit more complex environment. But industry says they're up for it, and we'll see how it goes.